Today, we're here with a hero. Hello and welcome to 18 WJTS in.form. I'm your host, Bill Potter. Joining me in the studio is Janet Schnell. Janet is a hero in that you are the Torchbearer Award winner for Indiana Suicide Prevention Network, and that was just announced December 9th. Tell me a little bit about that award.
It was a wonderful opportunity that I was given. You're notified that you have been nominated, and then within days of the conference, I'll let you know that, yes, you won this award. And it's really for the activities I have done since my brother died by suicide, mainly being a suicide prevention specialist and being able to train with suicide prevention, intervention, and after a suicide occurs. So they like to honor someone in Indiana to say, you've been outstanding, you're a torchbearer, you are an exemplament. You're just really, really good for the community. Mm-hmm. And so, yeah, that's what they were doing, is they were honoring different people.
Well, I'm honored to know you, and honored that you're a hero now, okay? Yeah. That's what you're listed as. Because you do a lot of work you started survivors of suicide. And I'm going to read some of the accolades here, okay? Torchbearer Award winner for the Indiana Suicide Prevention Network, presented during the Mental Health and Addiction Symposium Luncheon. She is, that is a partnership with the Indiana Division of Mental Health and the Indiana University Department of Psychiatry.
Right.
The award ceremony celebrates the dedication and commitment of Hoosiers who exemplify efforts and are heroes. And truly, Janet, you are. You are a licensed clinical social worker, currently a health provider with CARE ATC, and provides care through Kimball International Healthcare. You co-develop training in area schools to recognize signs of depression and suicide. These are things you know, I'm sure, but I want people to know this. You are the retrospective fatality analysis consultant, where research is used to better understand the impact of contributing factors on suicide and how to strengthen suicide prevention efforts and help to determine the cause of death and meaning making for lost survivors. You are a suicide prevention trainer for Question, Persuade, Refer, QPR, we'll ask about that, an applied suicide intervention skills training, and adverse childhood experiences. And in 1996, you started Survivors of Suicide, SOS, because of the suicide death of your brother Kent. And so you're on that board and you do a lot now.
Right.
And it says here, you accepted the award on behalf of lost survivors. That's the kind of person you are. You do this to help others. 135 people affected by each suicide death. I want to go back to this QPR. Question, Persuade, Refer.
Right.
Tell me about that.
So it's a program that's very similar to CPR. In 1 to 2 hours, we can train someone to recognize signs of depression and to really question a person, how to persuade them to get help, and then to have those referral sources. And so I'm a master trainer, meaning I can actually go out and train others to do the training, but I can also provide the training. And so it's very vital right now that we need to start doing more suicide prevention training.
Can that be a pretty gray area? Because, we all get depressed at some point.
Right.
We all don't have a good day.
Right.
And maybe you're afraid you're going to push somebody too far to the limit by questioning them. I bet that's a kind of a touchy area.
It's kind of actually a myth.
Okay.
That when it comes to talking to someone about suicide, you're actually taking this huge weight off their shoulder, something that they may have been thinking about but were afraid to talk to you about. When you start asking them, questioning them, they feel a lot better knowing that you really care and you're worried about them. And it can be something, I've been thinking about it. It's like, oh, no. Right now, it's just, life is just not great and I'm just really sad. I'm not suicidal.
And probably that's what they say every time. I'm not suicidal.
Right.
I could just turn around. You're working with two different planes, I guess you could say. You're trying to prevent that suicide in the first place, but you're also dealing with people who are affected by suicide, which for each suicide death, it's 135 people are affected.
Right.
That makes sense to me, but that's a lot of people.
That is. When Kent died in 1995, we were always told that only 6 people were affected for every suicide death. And I knew in our family alone, there was way more than that. So a good friend of mine, actually from the University of Kentucky, did research and followed up with that research. And it actually shows 135 people are affected for every suicide death.
Some of those people, too, you may not even know or be associated with, but that might be a trigger for some people, or it touches somebody that hears it on the news or hears about it through Facebook or whatever, and then goes, wow, that affects me, or I might know some. Hopefully, we can turn some of that to a positive.
Right. Right, and it is, every time you hear a suicide death, it takes you back. I mean, I go back and I remember what I went through with Kent, and so it takes you back to that day of, every time you hear that there's another death, especially if it's by like a sibling to sibling for me.
Now, I know you don't do this for you personally, but you are a torchbearer, okay? Why do you do this? Why are you concerned?
You know, I remember what it was like when Kent died by suicide, where we had no idea. And, you know, at that time, we had a lot of people who came into our county and was talking about suicide. We didn't recognize it in Kent. We didn't even know how to talk to him. I know what it's like to be a lost survivor. I know that pain that you carry for a lifetime. And so we do prevention, or I do prevention because I don't want to see another suicide, but I also want to be there for that lost survivor who was like me, totally alone and had no idea what to do next.
So I guess on one way, we want people to know, watch for somebody who might be suicidal and talk to them.
Right.
Not necessarily question them. And then what if you need to refer? Who do you refer them to?
Yeah, we have great organizations here in Du Bois County, Memorial Hospital Counseling Center, Life Springs. We have individual counseling centers that are all here in this community. We have a lot of really great resources that for people who can help, people who care. And because of COVID, well, that's a downside, right? But now in the state of Indiana, we can actually offer telehealth. So start out first locally, meeting face to face, and then, you know, where there's always so many more resources, I'm more than willing to share information.
Is there a number they can call, a website they can go to?
If you are worried about someone or you're having suicidal thoughts yourself, there's a new 3-digit number, 988. And you can call them and they can actually find the resources for you. And so they're specially trained for crises of all kind, and any kind of information that you need, they have access to immediately, but they also know how to talk to you.
So that's pretty simple, like 911, 988. I'm glad that there's such a simple number for people to remember, 988.
I do.
You are on the board of Survivors of Suicide. Tell me about that organization.
We started after Kent died by suicide. My mother, my sister, and I drove to Louisville, Kentucky, just to go to a support group because we didn't have anything local. So then we started something here, and now we have grown and grown a lot. We have wonderful board members, and I couldn't have gotten this Torchbearer Award without their support. So the people we have on our board is Janet, and we have Joni, we have Emily, we have Alan, we have Shelby, and we have Mary Lou, all offer support and help. So that really this award, like I said, was for lost survivors. It's for all of us because we all stand together, and we stand together much stronger.
Now, every time I see you, your hair is always colored like this. This is not because you made a mistake when you were dyeing your hair, right?
Right.
Talk about the colors.
The colors stand for suicide prevention. It's turquoise and purple. And so it's a great conversation starter, especially for the youth. I hear many times, oh, I love that, your color of your hair. Well, it's suicide prevention colors. And it's a simple way to start talking about suicide. And many times I hear their stories about having their own thoughts or past thoughts or being a lost survivor. And it's through the colors that just gets the conversation started.
Now, in my mind, I'm thinking holiday time, different holidays throughout the year. That's a time when suicides go up. Is that true?
No, that's actually a myth.
A myth.
A very
Not
big
true.
myth. Not
Okay.
true at all. And so what we know is that, again, through research, it really depends where you live, but the holidays are not one of them.
Okay.
And so like where we live now, where the sun is going away, we don't see as much sun, we actually see more of that seasonal affective disorder and the lack of sunshine. So, you know, around the winter time where things start to get a little bit lighter and then we get snow again and it's dark, we see an increase then. You know, on college campuses, you see an increase in suicide deaths at graduation time or at the beginning of the actual school year. So it really depends where you live as to when we see the higher rates of suicide.
A lot of triggers.
Yeah.
A lot of things that get that. And it could just be, you know, in the middle of summer when things are going well. And sometimes it really surprises people.
It does.
Yeah.
Yes. And that's where the one part that you had talked about, the RFA, the retrospective fatality analysis, is we're wanting to really learn more. We want to really better understand why suicide occurs instead of it just being more of a, you know, these are some of the things that we see. We need to be more updated. But for me, what I really like about that program is that it also is meaning making for lost survivors. Our biggest question is why? when that suicide death occurred, and I remember with same thing with Kent, why did this happen? Going through this interview, and it's something that I can provide for the community, but going through this interview helps loss survivors to better understand why the death occurred. Not to place blame, but to understand why it happened. And that's really what they come to the conclusion, not me.
Now, you've got several books in your hand. There's obviously resources available for people.
Right. We have resources with survivors of suicide. After a suicide death, sometimes you want to be able to read, and we have like little short snippets of things to read. We have longer pieces of information to read. We even have grief, how to help children through grief. And then we also have a journal, because it's very important to start journaling about your experience, to get those thoughts out and put them on paper.
Do you work with police agencies to help them out?
Absolutely. Anybody who requests services from us, we are right there with them, by them, and be able to offer that support. Really, we have 5 trained people who can go to at the scene of a suspected suicide death, so that we can help those family members and their friends on the other side of the yellow tape. We don't impede upon the investigation at all, not even close. We're there to help really those people who are there who are just so lost and don't know what to do next.
Well, Janet, thanks for the work that you do. Congratulations. A Torchbearer Award. I'm sure you didn't work to get this award. Now you're going to stop. I mean, that's just a recognition of what you've done. And it's also a recognition for people who go, well, I guess suicide is more of an issue than we think, because it's one of those things that generally you kind of hide.
Right. And we're definitely seeing an increase in the United States now, an increase in suicide deaths. And it can be prevented. We can do something to be able to find the resources, be able to talk to people about suicide, for it not to be an option.
So 988 is the number to call if you feel you might be suicidal, or you know someone who is, for guidance on how to take care of them. Is that what?
Right.
Okay. All right. Anything else that you'd like to add?
No, I think that's it.
Well, we're proud of you, Janet.
Thank you.
Thank you for what you do to help prevent suicide. It's a shame that your work even has to exist, but it does, and thank goodness there's people like you out there who are doing the work that you do.
Thank you.
Our guest has been Janet Schnell. Now, Janet is, again, the Torchbearer Award recipient from the Indiana Suicide Prevention Network. But more importantly, really, you work hard with the survivors of suicide, and that one individual that you have helped out is more important than anything you do.
Absolutely.
Thank you, Janet Schnell. Thank you for watching 18 WJTS. We are local people watching local people.